As Olivia has introduced, my name is Paul Creech. I'm the Chief Program Officer with the Digital Health Agency. Firstly, can I thank both Olivia and the whole Parkinson's Australia team for the invite to speak with you today. Very keen to talk with you as a group in relation to some of the things that we're doing, but also under the theme for this year's conference, very keen to connect in, not just me individually, but as an agency, with the Parkinson's Australia membership and try and, I suppose, help as we look to digitally enable the health system. I'm sure I don't need to tell this assembled group, but one of the things that struck me, I've been doing health policy for quite a while, is that carers can make up to 180 decisions a day in relation to the people they're responsible for. It's no mean feat. And really what we're trying to do is to support that a little bit. As a carer, I have a mum with not only Parkinson's, but now Parkinson's-related dementia. I know how challenging it can be when you're put on the spot to answer questions about past health information. And being able to support that, even in the simplest way, is really, really powerful. So pleased to hear Olivia talk about your want for empowerment. That is the journey we are on. How do we help to empower Australians as health consumers, make them informed patients, and how do we take a responsive health system and make it a preventative health system? If I can just add my acknowledgement to the traditional owners of the land as well, and pay my respects to elders past, present and emerging here on Ngunnawal country. I thought I'd just start by giving you a little bit of an overview as to the Australian Digital Health Agency. I expect many of you, most of you, probably don't know who we are. The agency is an agency within the broader Department of Health, within the broader health portfolio at the Commonwealth level. We are funded not only by the Commonwealth, but by all states and territories. Every jurisdiction and the Commonwealth contribute to our cause or our vision, and that vision is digital enablement of the health system. Our role, our vision, a healthier future for Australians through connected care, is to try and drive connectivity or interoperability throughout the health system and actually place the information in the hand of the patient. Consumers, carers are central to this. Okay, this is why we do it. It's about making sure that you as a consumer or a carer have the information you need when you need it to make those decisions. We cannot do it on our own, so working with consumer groups such as yourselves is a big part of what we're trying to do. I just wanted to touch on the strategies, I suppose, the North Stars that guide us. The National Digital Health Strategy is a 5-year plan that has been in place since 2023. It was actually recently recognised by a university in the EU as the leading digital health strategy in the world. It's something we're very proud of. Really, if you have a look at the strategy, you will see it is about empowering consumers. It's about how do we make sure consumers have the information they need when they need it. Supported by another couple of documents, it creates a framework. The second one there is the National Healthcare Interoperability Plan. It provides standards and guidance for health providers, software vendors, jurisdictions, in relation to the systems that they develop or put in place to support healthcare, whether it be in a public hospital, primary care. And the intent of these frameworks is to, as I said, guide digital enablement of our national healthcare system. The last one there that I just wanted to touch on is the National Healthcare Identifiers Roadmap. The HI roadmap, as we know it, is about how do we identify everybody in the health system and make sure that the people that have that need the information require and can access that information. So it's not just for consumers, that identifies providers at every level, in every jurisdiction, in every setting. But those documents together provide our North Star, and they're helping us provide the framework for others as to where we want to get to as a sector. I wanted to touch on, I think it's fair to say, and it probably won't come as much as a surprise, one of the things that we are known for the most is the My Health record. It's had what I'd call pretty much a challenging history. It's been around for a little bit over a decade now, and it has been a challenging history. The power of the My Health record, though, has always been the consent legislation that governs it. not the technology that drives it. The technology is being modernised at the moment and will continue to be modernised over the coming years. It'll provide easier access, more seamless access to information. But that consent legislation that's in place is powerful, and it's been in place now for 12 years, and it does work. When people engage and they realise the opportunity that provides, they stay engaged, providing the information is there. And I'll talk about that a little bit later on. But the legislation is important, and it's all about the consumer. I'm not sure if you're aware or not, but if you're not, with the My Health record, you as a consumer or a carer can access, providing you have consent, can access and control your own record. You can lock it down from anybody and everybody, or you can share the information you need to share with your border care team. That is the intent of My Health record and digital health infrastructure more broadly. I just wanted to touch on growth. I suppose the last few years it's been an interesting journey. As I said before, I think the start of this road was challenging. 2012, My Health record kicked off. 2016, the agency came into being. In many ways, we're still quite young, being in for 8 years. But as of today, 99% of GPs, 99% of pharmacy and public hospitals are all registered and connected to My Health record and can share information with the record. They can. They don't always do it. We as consumers need to be a little bit more demanding about that. As I said before, as a carer for a mother with Parkinson's and dementia, she's got a wonderful care team, and she does. Some of them share with My Health record because I ask them to, and some of them don't, and they still don't. It is a challenge every single time. I'm what I would call an informed consumer, I hope. And I am quite demanding when I want to be, but they still don't share. So we do have challenges in this space, and we're working hard with the department, states and territories and government to drive change, and with Parkinson's Australia now, to drive change and make sure that information is available. As far as the record itself, it may come as a surprise, it may not. A little over 24 million Australians have a My Health record. 2018, we transitioned from opt-in to opt-out. Many of you will probably remember. Just short of 10% of the population opted out. Interestingly, I don't think it was a surprise at the time, and it isn't now. Interestingly, a little over 300,000 of that 10% have opted back in since, which I think shows that people need the information when they engage with the health system. Health system is quite different to many other. You really only engage with it when you need it, and we have seen some good change the last few years. But 24 million records, and of them, 99% of records have information in them now, and that has changed since COVID in the main incredibly, with things like vaccinations. But I think community expectations have changed as well, especially on the back of COVID. And a consumer's want for information to support their own healthcare journey has become quite powerful. You'll see there, we've got a figure of 1.6 billion documents have been loaded into the My Health record system since its inception. So that's 12 years ago. And 1.6 billion documents probably doesn't seem like a lot in the whole health system when you consider the 12 years. The thing that is interesting, the thing that is driving us the most, is more than a quarter of that 1.6 billion has been in the last 12 months alone. And that is because consumers are asking for it. On the health professional side of things, things have not changed too much, but consumers are asking for it. Consumers are demanding their information. On the back of COVID, with the mandate for vaccinations and the requirement for pathology reports, growth really did explode. But what was really, really impressive, what was really quite good, was it wasn't just the information going in, it was actually consumers accessing it. As I said, just to touch on this, we've done a lot of surveys the last little while in relation to what consumers want, and it's always pretty consistent. Above 80% of consumers want to use digital technology to manage their healthcare information. They want access to the information in the palm of their hand often, when they need it, so they can share it if they need. They don't want to have to continue to retell their story. When I've been in the Digital Health Agency for 4 years. Before that, I was with Medicare for 5 years, and before that, I was with the Department of Health proper in a policy space for about 16 years. One of the things that I have seen throughout, because I have been in contact with digital health the whole time, is in the lead up to opt-out, at the creation of the My Health record, so from 2012 through 2016-17, we did used to get a lot of correspondence from consumers concerned in relation to who had access to their information. Hundreds a week in the early days. We do not get a single letter now and have not for a long time. We do, however, get letters from consumers wanting to know why the information that they think should be there isn't there. They've been and they've had a pathology test, they've had diagnostic imaging done, they've filled a script, and they want to know why the information isn't in their record. And that change in consumer expectation, that change in community want is really driving the change for us, which has been really pleasing to see. Olivia touched on some of the work that we're doing with Parkinson's Australia. It's only relatively new. It's been about 12 months, maybe a little bit longer. We're really keen on this going forward. I think in the early days, the agency, the program itself had a focus on health professionals and getting them into the system so they could share the information. I think the last 3 or 4 years, what we've really seen is that focus really needs to shift now and make sure consumer is central, and it is. It absolutely is. And that is actually what's driving the change. One of the things that I really want to push on today is the fact that change in focus for us is having real results. But moreover, it's enabling carers and consumers for healthcare information in Australia to be empowered. We want to modernise the infrastructure, don't get me wrong. My Health Record, as it is now, has been, as I said before, criticised in the past for being clunky. The app, the most recent edition, I think is extremely user-friendly, and I hope you've all got it. If you don't, I'll talk about it in a minute. But we are on a modernisation journey when it comes to the information. The want going forward isn't to maintain a central repository approach, it's to modernise that information and provide access to the information where it's stored, providing the consumer consents. But that modernisation journey is something we're working together on. And agreements with organisations such as Parkinson's Australia and others. We do have a number of agreements in place now with condition-specific groups and other consumer-based organisations, is us wanting to better understand what you need as a group, what your members need as a group, what carers and consumers need as a group, and try to make sure that we build that into all of our products and services going forward. The research that we've done with Parkinson's Australia has been quite powerful. In many ways, it's confirmed a lot of the things that we've already known, but there's new things coming through with the Parkinson's work as well, especially from a carer perspective. And going forward, what we're keen on now is working through things like focus groups and interviews, people living with Parkinson's. We're now looking to learn from these incredible insights and, as I said, build that into those products and services going forward. We're very, very keen to make sure that we use those insights the best way we possibly can and provide it back in a way that is not only functional and usable, but can help to empower and improve health outcomes. It's quite exciting, the project I actually got on with you guys, and I'm very, very keen on it. I wanted to touch on this slide. Many of you will know or will have heard of Minister Butler's Strengthening Medicare Task Force. A quote on the screen is something that resonates with us in a big way, and it's something that we're very, very keen to make sure that we continue to push going forward. I absolutely believe this too. Digital health technologies, if we get the right policy settings and the right regulatory environment, digital health enablement is one of the things that can really take our health system forward and can really start to drive improvements to health outcomes for consumers. As I said, the word empowerment is not lost on me. It's something that we talk about every single day. To that end, what are we doing? In the context of Minister Butler's quote just a minute ago, one of our main focuses, in addition to everything else that I've talked about around consumer-centric and empowerment, is something that we're calling share by default. It's a policy change and a piece of legislation that's gone through the Parliament only recently to require the sharing of pathology and diagnostic imaging information with the My Health Record going forward. It passed the Parliament in February, bipartisan support pretty much, and it will come into play in the next 12 months or so. But it will take the My Health Record and national infrastructure more broadly, because national infrastructure is bigger than My Health Record. It will take that and it'll make it a requirement, not a nice to have. So if you want to use, control, access your information through your My Health Record, when you go to your My Health Record, that information will be there. And that is the change we're looking to make. In the past, one of the biggest issues that we had was a consumer that got engaged with the health system and wanted access to information. Because it wasn't a requirement, they would go to their My Health Record and they wouldn't find the information they wanted, so they'd drop out of the system. They wouldn't go back. That is one of the big changes we're looking to make now to try and make that work better going forward. There's two graphs that I talk about a bit. I've brought one of them with me today. In relation to pathology, if I could just give you an example, on the back of a conversation that started about 12 months ago in the lead up to the passage of that legislation, we started to see the sharing of pathology information grow rapidly. And I think we're up to over 3.5 million a week, which is terrific. It's 160 odd million a year reports going into national infrastructure for people to be able to control completely. And whilst that's such a good number, it's still only about half. So we've got a lot of work to do, hence the legislation and the move to share by default. But the thing that has pleased us the most, I think, if you can have a look at that slide there, only a couple of weeks ago, I think that this one doesn't quite capture it, but only a couple of weeks ago we passed 1 million individual views by consumers a week of their own pathology information. So that's people going in and they're accessing their own reports themselves. 1 million times a week. And you can see the growth through the last few years. One of the things that's really fascinating for me, and I think kind of proves that point in relation to if people find what they're looking for, they go back. You'll see the spike in January 22, that was the height of Omicron in COVID. In Sydney especially, when you needed proof of a negative pathology test to go out to access services, movies, so on and so forth. That was a pretty impressive month for us back then. It continued to grow. As we've moved through COVID and out the other end, people that have gone in and used the system have continued to use it, which has been really, really impressive for us. And I think it's that consumer control, that consumer demand that will change the system for us. And the app, I wanted to touch on the My Health app as well. For those of you who don't have it, there is a QR code there you can scan. I've put on the screen a number of the current features and as well what our future focus is. But really what we're after with the My Health app is to be able to empower a carer or a consumer with access to their My Health record wherever they are. I don't know how many times I've been to a lab or a GP, with mum especially, and they're waiting on a pathology result, so they're waiting on a DI test and they don't have it. It hasn't been sent to them, and I can share it from my phone. Okay, it really is quite powerful. The amount of times it prohibits you having to tell your story again or recall information on the run that can be really, really challenging, and make sure you get it right. It's important that you do. So the app is really important to us. It's been out now for a couple of years. It's been quite softly. The intent for us is to make sure that consumers know about it, they can control it and they access it. But we are really keen on focusing on the app going forward to not just manage My Health record information, but really start to expand that out. I'll touch on in a minute, one of our focuses now is electronic prescribing and prescriptions. I don't need to tell you guys that Parkinson's patients especially are usually on an awful lot of medications. As a carer or even a consumer, if you can actually look into your phone and see a full medication list, it is a really, really powerful thing. So the app is something we're very keen on and looking to continue to grow it out. And it's one of the things that we'll be working on with Parkinson's Australia as to how do we make it useful for your cohort, for this group. I've touched on this slide, but that consumer empowerment piece is big for the app. It's how do we make sure that you've got that information with you wherever you go, regardless of setting, whether you go from, you might go from acute care to GP to aged care, and that information can follow you or follow your carer. And the last one, as I said, was medication management. I just wanted to touch on the work that we're going to be doing going forward, because we will be engaging with Parkinson's Australia on this. How do we make sure we get the information flow, the consumer journey, the empowerment piece right for consumers and carers when it comes to medication management? There are a number of e-script management apps on the market, and you can use any of them. It's not about demand and control. For us, it's about putting all the information in one place so you have it when and where you need it, and scripts is a big part of that. So we've built in electronic prescription functionality already into the app, and it went live in December last year. We're going to continue to improve that going forward. We're at the moment building in active script lift functionality. For those of you who don't know what that is, you can register with your pharmacy and they will manage all of your scripts for you. You won't need a paper script or an electronic script. If they just give them your name, they'll be able to access all of your scripts. And I know with mum, she uses the same pharmacist all the time and she doesn't want to have to worry about things like that. So active script list has been really, really important. And really what we want to do with the app going forward is provide you as a consumer or a carer the ability to manage active script lists. So choose the pharmacy you want to register with, send that registration through, potentially even send scripts through in advance when you leave the GP, not even have to go into the pharmacy. And one of the things that we see, if you combine the two together, a really powerful tool with the app in a way to start to help the consumer on that healthcare journey. So not just about managing a script, but also about notifications, things like adherence, reminders for medications, script expiry, so on and so forth, providing access to consumer medicines information. We've built into the app the ability to find a GP, book a GP, symptom checker, building out that functionality in a way that supports consumers. And again, we're very keen to work with you and your members on how that looks going forward. And that's it from me, Olivia. Thank you very much for the opportunity. I do appreciate it.